Thank you for joining me today. Today you will learn Alprazolam. You will understand mechanism of action of Alprazolam. You will review the pharmacokinetics and metabolism of Alprazolam. You will identify clinical indications and dosage principles of Alprazolam. Will recognize adverse effects and safety consideration. We will discuss dependency, withdrawal, and tapering strategy of Alprazolam. So stay tuned. Thank you. Alprazolam has a black box warning that everybody should know. If you use opioids, it can lead profound sedation, respiratory depression, coma, and death. Alprazolam drug classification. Alprazolam has a clinical use and safety consideration. Alprazolam is a benzodiazepine medication. It is Schedule 4 controlled substance. It is anti-anxiety medication. It has saturation and hypotonic effect. So this medication, it can be used only prescription from your doctor from reason that allows you to have it. It's risky to your life and risky to the health of the person. So only thing this medication can be taken is prescription and it's controlled. The reason it's controlled is because it's risky to the life and health. So the mechanism of action of Alprazolam is that it improves GABA receptor. It improves sedation. It increases the sedation and it improves GABA. That means you will be calm and it will lower the brain activity and excitation of the brain. That is why it leads to coma and respiratory depression. Pharmacology receptors for Alprazolam is it binds to Alprazolam site between alpha and gamma subunits. It's highly affinity for alpha 2 and alpha 3 subunits for anxiety effect. Alpha 1 subunit involves sedation and insomnia. Pharmacokinetics for Alprazolam is that it's quickly absorbed. It peaks in the plasma level, which is the blood level, with 1 hour to 2 hours. It has a higher protein binding, so it binds to the protein. It metabolized in the liver. So if you are going to prescribe this medication with patient who has a liver damage or liver failure, it needs dose adjustment. Metabolism of Alprazolam involves enzyme CYP3A4 is the primary pathway of metabolism Alprazolam. Its active metabolism is minimum. It has a drug-to-drug interaction risk with other medication with CYP3A4 inducer or inhibitor. Half-life span is average 11 hours and ranges to 6 to 27 hours depending on the age of the patient, for the client, and hepatic function, the liver function. If the person has a high liver metabolism, the drug will go quicker. if the liver function is low, it will be staying in your system and it will go through lower metabolism. Clinical indication for alprazolam is a general anxiety disorder, panic disorder, short-term relief for anxiety symptoms. But it also has off-label use, which include anxiety-associated depression, pre-medication for procedures, catatonia. Alprazolam dosage principles. Alprazolam, you start slow and you titrate cautiously if you need to. That means you increase slowly if you need to. Typically, general anxiety disorder dosage is 0.25 to 0.5 3 times a day. Panic disorder may require higher dose. Avoid long-term use when possible. So alprazolam, you use it short-term, you start lower, you increase lower if you need to, but it's a short-term use. If the patient or the client continue having anxiety, you switch to SSRIs. Alprazolam has extended release formation. It's once a daily dosing, smoothest plasma level, lower in interdosage, and lower withdrawal risks. Alprazolam has a special population consideration. Elderly, they have increased sensitivity to this medication and they have a fall risk. Because alprazolam has a sedation effect, they have a risk to fall. So lower the dose and be cautious for prescribing this medication. To elderly, hepatic impairment patient, they have reduced the clearance of this medication. So prescribe low dose if you have to. Because the toxicity will be higher, the medication will stay in their body longer, and toxicity is higher for the people who have a liver impairment. Women who are pregnant should avoid taking this medication if possible, because there is a risk for the fetus. Common effect of alprazolam is sedation, cognitive slowing, and psychomotor impairment and fatigue. Alprazolam has a serious side effect, as we mentioned before. It has a respiratory depression, especially if you take it with opioids. It has a paradoxical agitation. It has a memory impairment, especially older adult, and increases risk of elderly. So elderly, they have a risk for memory impairment. They will be more confused and they will have an increase for fall. So lower the prescribing dosage. If you need to, you can titrate, but start low and increase little bit by little bit if the risk is manageable. Alprazolam has a drug-to-drug interaction, especially medications that inhibitor or inducers of enzyme like C1P3A4. So be careful. Also the alcohol and also depression medication is leading to additive effects. That means it will increase the sedation. If you take alcohol with this drug, you could be coma. It will lower your respiratory and it can lead to death. Also, if you take antidepressant medication, it will increase the sedation effect of alprazolam and it can lead to coma or respiratory failure. So be careful. Alprazolam has a tolerance and dependency effect. It develops with prolonged use. Higher risk with short-acting benzodiazepine physiology dependency are common. Alprazolam has a withdrawal syndrome. It increases the anxiety, so it has a rebound anxiety, insomnia, tremors. It can lead to severe seizure. It requires gradually tapering. So what are the tapering strategies? The tapering strategy is reduce dosage 10 to 25% every 2 weeks, every 1 week or 2 weeks. Consider switching to long-acting benzodiazepine, because this one is short-acting benzodiazepine. Monitor for withdrawal symptoms like shaking, like increased anxiety, like seizure, like insomnia. Alprazolam has a higher misusage and diversion risk. Rapid onset increases reinforcement and higher misuse potential in the vulnerable adult. So that's why it's controlled substance. That's why it has to be used short term. That is why it has a black box warning. Alprazolam has overdose risks. It lowers the central nervous system activity. That's why it leads to coma. It lowers the speech, ataxia. It's rarely viral alone itself, but dangerous with alcohol and opioids. So if you take this medication with alcohol or opioids, you could go to coma and death. It can depress your nervous system activity, so it's hard for you to wake up, and it's hard for you to walk. It's hard for you to walk, it's hard for you to talk, it's hard for you to walk, it's hard for you to breathe, it's hard for you. So it will shut down your brain and breathe. That's why it leads to coma and death. Flumaxalin consideration. Flumaxalin is a benzodiazepine antagonist. Flumaxalin is used when the risk of a seizure is high for the patient who are chronic usage of a benzodiazepine, but flumaxalin is used cautiously. Clinical considerations: avoid using alprazolam as needed for chronic anxiety. Instead, use SSRI for chronic anxiety. Use scheduled dosage for panic disorder. Reassess long-term need for regularly. Alprazolam XR initiate with close monitoring. Monitor for sedation level, monitor for cognitive function, monitor misusage behavior, and monitor drug interaction. Patient education: avoid using alcohol with this medication at all. Do not stop this medication quickly. It has to be tapered. Your doctor has to decrease the dose slowly each week. It has to be slower, the dose. So gradually, you cannot stop this medication quickly. Also use this medication as prescribed. This medication is, as we talked about, is controlled substance. It's used only prescription, so only use the way it have been prescribed. Don't lower the dose, don't increase the dose, don't skip the dose. Just use the way it has been prescribed. Also tell your provider that any medication you are taking, because this medication can interact with many other medications that can increase the side effect, that can lead to risky of death, coma, respiratory depression, central nervous system depression, liver damage. So talk to your provider any changes with this medication. Key takeaways for this medication include this medication is a short-term usage only for anxiety and is only effective in short term. It has a significant dependency and withdrawal risks. It requires carefully prescribing and monitoring. So this medication requires tapering the dosage or titrating the dosage based on patient needs. It has a significant dependency and withdrawal risk, so it needs monitoring for the serious side effects. Also, it needs monitoring for misusage or dependency. Thank you for joining me today. I would love to see you in my next video. I will be teaching you and going over other medications